Okay, just a couple of slides left here, but I wanted to make sure I got the full chance to finish this explanation because we're on the path to understanding something I had talked about in the respiratory section in that lecture for chapter 4, and I wanted to be able to finish the explanation. So where we left off, we had formed a DVT in this patient, this theoretical patient we're talking about, in the popliteal region, which is very commonplace to have these sorts of blood clots. Maybe the patient has a clotting disorder in their blood and they're seeing a hematologist and they just happen to throw a clot. Didn't take their blood thinners that day. AFib might have caused it. Long periods of sitting without any movement, what can cause this? So once again, if you should never sit for longer than maybe half an hour to an hour without moving around a little bit. There's some wiggle time with that. And the younger you are, the less important it is. But definitely those in the age group of 60 and over should, keep movement, because once again, movement's good for the body for all kinds of reasons. Preventing blood clots is one of them, especially in that popliteal region behind the knee. Now, when we left the patient off, they had a DVT, so they had a stationary blood clot that was stuck in this area that you see. However, embolus is a potentiality here. It comes from the combining form embolo, which means plug. So an embolus is also a blood clot, but as you can see, it's a traveling blood clot. It's a mass, it could be a blood clot, or if a surgeon tried to remove plaque from a coronary artery and they shouldn't be doing that and they did it and the plaque got away from them, that could be an embolus. Could be an air bubble, but that's the least likely and really not very probable. It's very low odds of air bubble is going to happen, but it's possible, and it's traveling through the bloodstream. Now, you remember that concept I told you about a big pipe to a little pipe to a little pipe? So blood's leaving your heart. It's a big pipe, smaller pipe, and that's an artery. Then it goes through the capillary bed, and then it goes to a very small vein, right? And then a larger vein, and then a larger vein. So an embolus in the form of resulting from a DVT happens in a rather small vein. That popliteal vein behind your knee is not very big. As it ascends through the venous system to get back to the heart, it goes from a small pipe to a larger pipe to a big pipe. So it encounters no blood vessel small enough to stop its progress. Once it gets into the vena cava, it's en route to go to the heart. Now an embolism, a very small embolism, can pass into the heart, make it through the chamber, the right atria, make it to the right ventricle, get pumped out into the lung, and as it leaves the lung, it's big pipe, smaller pipe, because it's on its way to a capillary bed, right? And then it encounters an arteriole, which is smaller than the embolus is. And what do you have? Well, in this case, you have pardon me, I thought this was going to be the pulmonary embolism. You have a transient ischemia attack, a TIA. So this is a temporary interference in the blood supply to the brain. This causes no permanent brain damage. It's known as a mini stroke. It can be the warning sign of a potential stroke. So in this particular scenario, that little embolus got through the heart and it got in the carotid arteries and came up to the brain, but it wasn't enough to really cause a full stroke. What it did cause is a blockage that caused this mini stroke effect to happen. It could also happen as a result of a arteriospasm, by the way. But if that little embolus gets free and it ends up in the brain, it could be a TIA, which is relatively not a big deal. That embolus could become a heart attack because it might get pumped out of the heart back into a coronary artery, and there, instead of plaque blocking the artery, now you have a blood clot blocking it. It could make it into the lung field, and then it's a pulmonary embolism because now it's blocking the blood flow to the arteries that surround the capillary bed in the lungs. So it might happen there. And if it happens to make it to the brain, and all three of these things could be the same blood clot. If it makes it to the brain and it's more severe than the previous slide with a TIA, which is the mini stroke, you could end up with a cerebrovascular incident known as a CVA. This is an absolute interruption of blood supply to the brain. It causes permanent damage, and it's caused by a blockage of an artery or bleeding within the brain. So that little piece of blood clot that broke free, as I said, could turn into a heart attack, could turn into a pulmonary embolism, could turn into a full-blown cerebrovascular accident known as a CVA. That's why those little blood clots are dangerous. That's why people with AFib take medications to thin the blood, That's why we want to keep movement going so blood doesn't clot in our veins. And that's why if you have a coagulation disorder and your blood clots too quickly, you need to be seeing a hematologist and a cardiologist to control that. Because blood clots traveling through the vascular system, there's really nothing good to say about it unless they're clotting a bleed. You know, if you cut your finger and blood clot comes to stop that, that's normal. But if it's traveling through and gets in the brain, heart, or lungs, it could have a whole different result. So that's the explanation for CVAs, for MIs, for PEs, meaning pulmonary embolisms. They happen as a result of that type of action. When we talk about strokes particularly, you have a protocol here, and this is a good one to adhere to. You've probably seen other versions of this, but it's really good to know. And I've seen all three symptoms they're talking about here. I have seen in patients more than a couple of times. I've had at least two I can think of in the moment. Patients who come in to be seen on Monday morning and walk in and go, yeah, I think I had a stroke on Friday afternoon. Like, okay. But they were frightened to know the answer, so they put it off and they survive the weekend and they show up and I look at their face and I see it's not symmetrical. So that's our first item here. Does the face look uneven? Ask them to smile. If they smile and only one side of the face moves and the other side, and I'll be honest with you, it literally looks like this, like the skin is almost hanging off the face because there's no control there. The brain has been damaged and those nerves, there is no control. So they'll try to smile, but they can only smile with one side. Another thing, and I've seen doctors do this one, they'll have them stand and say, I want you to hold your arms out in front of you like you're Superman, like you're going to fly. So hold your palms at the same height. And you'll see one will be much lower than the other. And they'll say, can you put them at the same height? And the patient will say, they are at the same height. That's another strong indication. So if there's anything in the coordination or how their arms work, and one seems to not be working, or a side of their body doesn't seem to be working, that's a big warning sign. And the third one is speech. Does it sound strange? Because people having strokes will often think they're speaking clearly. What they hear in their mind as they speak makes perfect sense. And what's coming out sounds like a 6-month-old trying to communicate. It's just sounds and grunts and things. They don't realize, in some cases, they don't realize that they're indecipherable in what they're saying. They think they're being perfectly clear, and sometimes they will be absolutely stunned that you can't understand them. Any one of these three symptoms, it could be something else. It could be something called Bell's palsy affecting the face. There could be another reason the arm doesn't work or speech is slurred. But any one of these is concerning enough that you should try to seek emergency medicine as quickly as possible, because what you have left is time. So that's the FAST protocol. Assess the face. Is it symmetrical? Are things working? Assess body movements. Does one side of the body seem to be equal with the other, or is one side dominant and the other side seems to be doing nothing? Is the speech slurred and indecipherable? You see all three of these, and that's probably a stroke right away. That's a CVA. So then you have time. So you want to get them to an emergency room. I would take them to an ER over an urgent care, but if urgent care is all you have, then go there, but get medical attention right away, because time is all you have to try to save that tissue that's at risk. In this particular situation, be it a stroke, a heart attack, anytime that there might be a clot involved, thrombolysis, that protocol will kick in, and part of that protocol is using an anticoagulant. These are substances that prevent blood from clotting. So when you see those AFib commercials on television, they're talking about anticoagulation therapy. They're talking about a type of medication you would take that will thin the blood and keep it from clotting. So people who are at risk, say those who have AFib, they're at risk of throwing a clot, and we don't want to see them have a heart attack. We don't want to see a stroke. We don't want to see a pulmonary embolism. Then an anticoagulant would be the appropriate way to treat it. They can be tricky, so there's different types used for different purposes. And of course, that gets into specialized medicine. We won't cover that now. Just know what an anticoagulant is. Agglutination. This is the last thing we'll be talking about with blood. If you've ever had to have surgery, before you went in, they did something called a type and cross. So especially major surgery, they want to know, A, what your blood type is. So you type A, type B, type O, or any of those categories that fall under blood type. And they want to know, and then they want to make sure that they have that on standby in case you happen to bleed out during surgery. They can then infuse blood. So a type and cross is a blood test that a doctor can order for you. And if you're not having surgery and you just want to know what your blood type is, it's going to cost you about $300 to get the blood test. But I'll share a secret with you. If you want to know your blood type and you don't want to pay for it, go to the Red Cross during their blood drives and donate blood, because they will tell you what type of blood you have. You can have that card and carry it with you. That takes out the type and cross procedure, especially in emergency, because they're never going to infuse blood till they know what your type is. Even if you have a card from the Red Cross, they're probably still going to double check it to make sure. Because if they don't, and they put a different type of blood in you than your body can handle, agglutination is going to result. It's the clumping of blood cells, and it results when different types of blood are mixed together. So it's like an automatic blood clot. It happens as the blood's meeting each other, and it is not a situation you want to have to deal with. So surgeons and people who work in the OR are very good about being set up for this type of thing. They're very good at making sure it doesn't happen, and you very rarely ever hear of it happening in modern medicine. Decades ago, not so much. Sometimes it did happen. But if you mix the wrong types of blood, agglutination will result. So we want to prevent that altogether. So go to the Red Cross, donate some blood, learn your blood type for free. You get a cookie, you get an apple juice, you can hang out for a while, maybe meet some cool people or take a little nap. And you've done something good, and you might just save a life as a result. So all these are good reasons to donate blood, especially if you're young and healthy and ready to go. Okay, some abbreviations for you. Once again, I'm not going to read them down. We covered them as we went through the lecture, so you can look at them here. Know that, some of them are going to be on your exam this weekend, so have a general idea of what they are. Thanks for your time and attention. It's everything you're going to need to know about the cardiovascular system for this week's exam. Just enough medicine to be dangerous, so don't go out and diagnose anybody, but definitely, watch those cholesterol levels, eat well, get lots of exercise and fresh air, and all that general medical stuff. Anyway, thanks for your time, and we'll return next week with chapters 6 and 7. Thanks.